My name is Angelina Brotherhood, and today I want to introduce you to the European Drug Prevention Quality Standards, the EDPQS. I'll structure my talk around these 4 questions. What do the EDPQS look like? Why are they important? How can they benefit you? And where can you find out more if you're interested? So for the first question, what do the EDPQS actually look like? The EDPQS are essentially a manual that was produced by the Prevention Standards Partnership with co-funding from the European Union and published by the European Monitoring Centre for Drugs and Drug Addiction, the EMCDDA. You can see a picture of the manual in the slide. It contains the quality standards in detail and provides the first comprehensive reference framework on high-quality drug prevention based on European consensus, and I'll come back to that later in the presentation. If you open the book, you will find inside this project cycle, which is very important. It represents the core structure of the standards, and it's also the core structure of the manual, so that each chapter in the manual corresponds to one of these project stages. It describes the ideal life cycle that a prevention activity would run through. So from needs and resource assessment to program formulation, intervention design, managing and mobilizing necessary resources, delivering the intervention and monitoring the implementation, final evaluations, dissemination and improvement, and then hopefully start the cycle again. In the middle of the project cycle, you'll find a few aspects that are always important. They're important at every project stage. So we've called them the cross-cutting considerations. They relate to the sustainability and funding of activities, communication within the team but also with external stakeholders, staff development and staff support, and the ethics of drug prevention. And this project cycle is really quite useful to think about prevention in a systematic way. The standards are structured at 3 levels of detail. The first level of detail is made up by the project cycle. The second level of detail is made up by components. There are 35 of them within the EDPQS. Under the cross-cutting considerations, there are the 4 components which I just mentioned to you. Under needs assessment, we also have 4 components. The first component is about being aware of drug-related policy and legislation. There is a component about assessing drug use and community needs that are related to drug use. There's a component about describing the need and really justifying the intervention. There's also a component about understanding the target population. So asking, what is the target population's view? What do they perceive as a problem? Where do they think they need support and help? I would like to take some time now and talk you through the components in each of the remaining project stages. This is quite important because it really shows the content of the quality standards. So it will help you to understand what are the quality standards that should be applied to drug prevention work. Under the resource assessment, we have 2 components. On the one hand, considering the resources available from the target population and the community. On the other hand, thinking about our internal capacities. What resources do we actually have to carry out an intervention? On the program formulation, we would consider who's the target population of our intervention, what theoretical model do we actually apply, what are our aims, goals and objectives with this activity, where is the activity carried out, in what kind of setting, what evidence of effectiveness can inform our activity, and what is the timeline of the program. And by that, we don't just mean how much time we spend with an individual participant, but it relates to the entire project, so also the planning and the evaluation of the project. On intervention design, this is really about designing an intervention that represents quality and effectiveness. There are some standards relating to selecting an existing intervention. For example, if you're looking at a database of recommended programs. It is always important to tailor the intervention to the target population, to make sure that it relates to the specific characteristics of the people you're dealing with. And if you're planning final evaluations, then you also need to consider this already at this point, so that you think in advance what kind of data you will need, who you will collect this data from and when, and so that you can integrate this really in the intervention design. This is the project stage around managing and mobilizing the resources that you need. So the first component here is about planning the program And that is very important because you need to reserve some time to come up with some sort of plan that can guide your activities and that you can come back to at later points to see whether you're on track. You need to plan the financial requirements, you need to think about the people who will be working on the program, you need to think about how to recruit and retain participants, so how to invite them, what incentives to provide for them that they take part. You will need to think about the program materials. That could be materials that you give to the participants, but also other materials you need like computers, rooms or other equipment. And you'll need to think about providing a program description. So for example, what information will participants receive about the program that will help them decide whether they want to take part or not. And then finally, we come on to delivering the intervention. And before you do that, the standards suggest that you should consider whether a pilot intervention is needed. Now, that might be the case if the intervention is very expensive, if it is a very big project, for example, if you want to roll it out in an entire region or entire country, or if it's never been done before, you've developed something that is very new. So, of course, you might want to test it first. The idea is that you test it first on a small scale, and that if there are any problems, you can correct them before you undertake the actual implementation, when of course it would be a lot more difficult to make any changes. So then you go on to implement the intervention as planned, but it's also important to monitor the implementation. Is it all going well? And if not, to consider adjusting the implementation. So there is a balance there between sticking to the original plan and making necessary adjustments. For example, if you see that something is not going well, or if circumstances have changed, the target population doesn't need this kind of intervention anymore. So there are some standards around finding this balance. The quality standards also contain a project stage called final evaluations. Here we distinguish between an outcome evaluation and a process evaluation. The outcome evaluation checks whether you've achieved the overall outcomes in the participants. So for example, reduced drug use, reduced drug-related harms, increased health and well-being, or whatever the goals are that you have set for yourself. Everything else would be the topic of the process evaluation. So for example, how many people did you engage? Did they like the intervention? Did you spend your resources wisely? And then the final project stage is about dissemination and improvement. Here you should determine whether the program should be sustained, and this should be done based on the existing evidence about the program. And that doesn't necessarily mean a big evaluation trial. It can also mean the evidence that you collected during the monitoring, for example. So basically, all the knowledge you have about what went well and what didn't go well. And if you have a feeling that the program should be sustained, but it should be changed, then this is also the kind of decision you should be taking here. There's a standard saying that you should disseminate information about the program, so this is to support the learning in the prevention community so that others can understand what you did and whether it was useful or not so much. And finally, if you're producing a final report, there are a couple of standards around what information the report should contain and what it should look like. If you open the manual, this is what you will find inside. So you have the component title on the top left here. Then you have something called implementation considerations. So they are ideas about how to implement the standard in practice, why it is important. And then you find the actual standards at the most detailed level. We distinguish here between basic and expert level standards. The basic standards are the ones that everybody should try to adhere to. The expert standards may not always be relevant or feasible, although it's also important to look at those. The standards were developed through a structured process that took 2 years, so it's just important to be aware of where these standards actually came from. There was a review of existing drug prevention guidance, which resulted in a first draft, and then there were consultations with over 400 people in 6 different EU countries that led to a second and a third draft. And that's why I said at the beginning that the standards represent a European consensus. And here you can see the countries that have contributed to the European Drug Prevention Quality Standards project. 6 of these countries participated in actually developing the standards. The others have taken part in a follow-up project to develop support materials, which I'll also show you in a bit. What's important here is that there were countries from North and South Europe, West and East, and that the project partners participating in this project were not just researchers in universities, but also practitioners and policymakers who have a real understanding of the challenges that people face on the ground. So why are quality standards important? Now you can pause the presentation here for a second and try and answer that question for yourself. From my point of view, the question is, well, what is the problem that quality standards are trying to solve? Few people would argue that prevention is better and cheaper than cure. However, not everything that is done in the name of drug prevention is based on what works, on what constitutes quality. In fact, the European Monitoring Centre for Drugs and Drug Addiction regularly collects data on what kind of activities are being implemented. And that data suggests that a lot of approaches that would not be recommended are still being implemented. So there are still a lot of activities that are not based on sound evidence. There are still a lot of activities that just provide information on drugs. And we know, of course, that this kind of approach can only have a limited impact on young people's decisions whether or not to use drugs and the harms that will result from that behavior. And the problem, of course, is as well that money is still being spent on ineffective approaches when in fact the money could be spent on things that actually work and have positive outcomes. So the quality standards want to help with this. And how do they do that? People often think that quality standards are something quite scary. They hear the word standards and it brings up associations of everybody has to do the same thing. That's not true. What quality standards actually intend to do is to standardize our understanding of quality, because you and I could have very different perceptions of what quality actually means. So I want you to take a moment now and think about what are important aspects of quality. So the EDPQS essentially tried to answer this question. And this is what we came up with. High quality activities, according to the EDPQS, are those that are relevant to target populations and policy, ethical, which means they have no unintended side effects and they take into account the reasons for drug use. They're based on scientific evidence of what works. They provide evidence on their own effectiveness. They're cost effective, feasible, and sustainable. And now let's compare this with how quality is sometimes understood. Quality could also mean this. It could mean low financial cost. It could mean an activity that promises a drug-free world, even when the proposed activities are unlikely to achieve this. It could be an activity that's fun for the kids, even if it doesn't work, that allows nice photos for the school newsletter. It could be something that is easy to do and doesn't take much time. And you can see that in this kind of list, the actual quality or effectiveness is relatively less important. So you can see there are different perspectives of what quality could mean, and the quality standards help make explicit what we mean by quality. So how can quality standards like the EDPQS help to improve a situation where a lot of prevention activities are not based on what is considered good practice? So this is quite a busy slide. It's a simplified model of the EDPQS theory of change. And you can read more about the theory of change if you visit our website. I just want to highlight the last 3 columns here. Basically, all the outputs of the EDPQS project and activities, such as the manual and the supporting materials, which I'll tell you about in a moment, are targeted towards the people working in prevention. So not at the young people themselves, but they're targeted at the decision makers, the practitioners, the program developers, the researchers and evaluators, the trainers, and as I said, only indirectly to the general public and ultimate target populations. And what they want to achieve is to raise an awareness that quality is important, quality is an issue. Prevention is not always good per se, it needs to be high quality prevention. They want to motivate people to want to meet the quality standards and give them the necessary knowledge and skills so that they know how to apply EDPQS, so they can start using EDPQS and hopefully change how things are done and actually improve prevention practice. And then that should have an impact, namely increased quality of preventive work, changes in professional prevention culture so that poor quality prevention work is no longer acceptable, and finally this should lead to better outcomes for target populations. So it's really important to highlight that quality standards are not a goal in themselves, but they are one tool to support a process towards high quality drug prevention and good outcomes for the target population. Now, how can the EDPQS benefit you? You can pause the presentation here and think for a second how quality standards like the EDPQS can help you in your work. It's important to clarify what the EDPQS are not. So hopefully by this point in the presentation you should have understood that the EDPQS do not prescribe a particular type of intervention or policies. They also don't provide step-by-step instructions on how to undertake high-quality work. So for example, they don't explain how to undertake a needs assessment or how to evaluate projects. Rather, they specify what a high-quality needs assessment or a high-quality evaluation would look like. So what they do provide is a comprehensive set of criteria that can help you recognize high-quality prevention activities. So you have a set of criteria and you can check whether what you're doing or what somebody else is doing would be considered high quality or not. And they also outline the context in which quality interventions and policies will take place. Because if the surrounding environment is not supportive of high quality, then even if you use a very good intervention, you won't be able to implement it in a way that will have positive outcomes. Now, this is a very busy slide, and we have included it because people very often ask, what is the definition of drug prevention that is used within the EDPQS? And the important point here is that the EDPQS do not provide a normative definition of what drug prevention is. It is up to providers and governments and other stakeholders in prevention to define what they see as the aims of drug prevention. However, the EDPQS do specify which definition of drug prevention informed the development of the quality standards. So you can see here that this is a broad definition, and the purpose of this definition is just to say what kind of projects might benefit from the EDPQS, what kind of projects should consider applying the EDPQS in their work. So thinking specifically about how the EDPQS can be used in practice. So the key purpose of the EDPQS is to help review and develop the quality of prevention. And as such, they can help to plan new projects with confidence, so that even if you try to develop something new, you can refer to the quality standards to make sure that you're thinking about all relevant aspects. You can identify the strong and weak aspects of prevention activities. You can review the quality of ongoing or completed prevention initiatives. And once you have identified the weaker aspects of a prevention activity, that can also help you develop and improve the quality of existing prevention provision. But the EDPQS can also be helpful as a general reference framework for thinking and talking about prevention and advocating for high quality prevention. So as I said before, they provide us with a shared understanding of what prevention should look like. And as such, they can support a wide range of activities like information and awareness raising, education and training, professional and organizational development, project proposals and funding applications, evidence-based policy making, and of course they can be used to develop or update existing quality criteria and standards. And the point that I need to highlight here is that unfortunately the EDPQS can't guarantee effectiveness, because even a perfectly planned intervention might not work because of particular circumstances that we find in practice. However, adhering to the EDPQS should make it much more likely that an intervention will be successful. So hopefully by this point in the presentation, you have become more interested in the EDPQS and you want to know where you can find out more about them. So I've mentioned a manual. which is the most comprehensive resource on the European Drug Prevention Quality Standards. It's 284 pages and it explains the standards in a lot of detail and provides additional information, including a glossary of prevention-related terminology. There's also the quick guide, which summarizes the basic standards and includes also simple checklists that can be used as a starting point for self-reflection. As part of a follow-up project to the original EDPQS work, the Prevention Standards Partnership developed 4 EDPQS toolkits and other supporting materials. Now, these toolkits are supposed to be practical tools to support different audiences with using the EDPQS to promote and achieve quality in prevention, because as you can imagine, many people are not prepared or don't have the time to read a very thick book about quality standards. So these materials are much shorter and accessible. And the 4 audiences for the toolkits are decision makers, practitioners, trainers, and prevention advocates. So there's one toolkit that helps decision makers select activities that represent high quality for funding and other forms of support. There is a second toolkit for practitioners, which helps them to assess the quality of their own work and improve the quality. There is a toolkit for professional trainers, which contains materials that can be used to deliver training on the EDPQS, and this presentation is taken from that toolkit. And the 4th toolkit supports prevention coordinators and advocates who want to develop quality standards, who want to promote quality standards, or who want to translate existing EDPQS materials. The Prevention Standards Partnership also developed some other supporting materials. There is a brief summary on the EDPQS, and then there's also the position paper and the theory of change. In the position paper, you can find more information about the definition of drug prevention and the definition of quality within EDPQS. And in the theory of change, you can find more details about this model that I presented earlier in the presentation. And of course, there's also the Prevention Standards website, where you can find all of these resources, as well as many other materials, such as examples of how the standards have been used in practice in different European countries and also outside of Europe, and the contact details for members of the Prevention Standards Partnership in your country or elsewhere in Europe. So now I'd like you to take a moment to think about which of these documents might be most relevant to you and how you could start using quality standards in your work. Thank you for listening, and I hope you found the presentation useful.